Hi nursing family, how are you? I hope you are good, you are well. Today we will discuss about macrolides. Macrolides, it is a class, it is a group of antibiotics. In that so many antibiotics will come and in exams question will come like this. Write the 2 or 5 drugs which is belongs to a macrolides, their uses, their side effects, their mechanism of action, and nursing responsibility. As a nurse, we should write, we should know when you are going to exam or when you are caring the patient, you should know about all the antibiotics. So before starting the video, please subscribe my channel and press the bell icon. Now let's start. Macrolides are antibiotics with a macrocyclic lactone ring attached with sugars. Macrolides are antibiotics. Why we are giving antibiotics? Because of when we are giving antibiotics, antibiotics act with the microorganisms or bacteria to kill the bacteria or to prevent the growth or multiplication of bacteria. Then after you will cure. It is a macrocyclic lactone ring attached with sugars. Macrocyclic lactone is a chemical product which is obtained from the genus Streptomyces, which is present in the soil. So it is obtained from the molds of Streptomyces. It is a genus. In from there macrolides are obtained. Macrolides were obtained. They are bacteriostatic in some small doses but bactericidal in higher doses. If we are giving a small dose, it will act bacteriostatic, means it will only prevent the growth or multiplication of bacteria. But if we are giving a higher dose, higher concentration of medicines or drugs, it will act bactericidal. It will kill the bacteria. Now we will see what are the drugs which is belongs to a macrolides: erythromycin, azithromycin, clarithromycin, telithromycin, roxithromycin, lincomycin, vancomycin, and spiramycin. These are the antibiotics which is belongs to a macrolides. But how we will remember, how we will memorize for a long time? Now we will see one trick. In macrolides, all the antibiotics are hidden. If you know macrolides, all the antibiotics will come. M for macrolides, A for azithromycin, A for azithromycin, C for clarithromycin, then RO for roxithromycin. Now Li for lincomycin, E for erythromycin, S for spiramycin. Spiramycin. Why we are given thromycin? Because some antibiotics will come in last thromycin, 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 and some medicines mycin. So for remembering the antibiotics, thromycin. Some medicines will come thromycin in last and some are mycin. So for easily remember azithromycin. So we are making a one trick: macrolides, thromycin. macrolides, thromycin. M for macrolides, A for azithromycin, C for clarithromycin, R for roxithromycin, Li for lincomycin, E for erythromycin, S for spiramycin. So that are the macrolides antibiotics which is belongs to a macrolides. Now we will see mechanism of action. Macrolides is also inhibit the protein synthesis. Due to protein synthesis, when it acts inhibit the protein synthesis, bacteria will not grow, bacteria will not multiply. So macrolide antibiotics are primarily bacteriostatic. By binding to the 50S subunit of the ribosome, they inhibit bacterial protein synthesis. Now we will see what are the uses of macrolides, where we are using, where we have to use the macrolides antibiotics. It is uses in gram-positive bacteria mycoplasma. It is mostly effective for gram-positive bacteria mycoplasma. Pneumonia, that mycoplasma pneumonia. If pneumonia is having due to the mycoplasma pneumonia, in pharyngitis, tonsillitis, scarlet fever that occurs due to the streptococcal infections, in anthrax, diphtheria, syphilis, gonorrhea and tetanus. In these infections, in this disease, we are using erythromycin. Erythromycin is most effective in these infections or in this disease. Whooping cough, in whooping cough also, staphylococcus infections also, peptic ulcers, that is due to the H. pylori infections. If peptic ulcer is having due to the H. pylori infections, we have to give clarithromycin along with the omeprazole and amoxicillin. It is the combination along with the clarithromycin we have to give omeprazole and amoxicillin. That is most effective in peptic ulcer which is due to the H. pylori infections. Now side effects. These are the uses. Now side effects: GI upset, anorexia, diarrhea may be having, vomiting may be having. नर्सिंग रेस्पॉन्सिबिलिटी, एज ए नर्स, अगर आप एक नर्स हो और पेशेंट का केयर कर रहे हो तो आप मैक्रोलाइड्स के एंटीबायोटिक्स जब एडमिनिस्टर कर रहे हो तो पेशेंट में क्या क्या देखने को मिलेगा, क्या क्या आप एसिस करोगे जो डॉक्टर को नोटिस करना पड़ेगा, डॉक्टर को इन्फॉर्म करना पड़ेगा. Macrolides are acid labile, hence should not be given with fruit juices or in empty stomach. It is acid labile, it is react with acid and it is acceptable of acid, so we should not give with fruit juices or in empty stomach, because in empty stomach acid will come and it is acid labile, it is drug acid labile. If it will go inside the body, it will react acid to acid, so we should not give with fruit juices or empty stomach. सो जब भी आप इस दवाई को लें तो खाना खाने के बाद लें. मॉनिटर फॉर हिपेटोटॉक्सिसिटी, अगर इफ पेशेंट्स हैविंग hepatotoxicity, we can see elevated ALT and AST. When you are investigation for liver function test, in liver function test you can see ALT and AST, it will elevate since the liver mostly excretes macrolides. Because of liver mostly excretes, it is eliminate the macrolides, that's why it may be hepatotoxicity. Do not give. How we will notice patient may be hepatotoxicity? Because of ALT and AST will elevate. Do not give by IM or IV push because macrolides, erythromycin, azithromycin, all are maybe oral. So that's why we are not giving IM or IV. If ordered, if doctor or prescriber ordered IV, then administer as infusion after dilution in 100 ml normal saline, RL or sterile water. If डॉक्टर्स अगर डॉक्टर ने प्रिस्क्राइब किया है, डॉक्टर ने ऑर्डर दिया है, तभी हम लोग इस ड्रग्स को आईवी इन्फ्यूजन में एडमिनिस्टर करेंगे, उस पर भी 100 ml नॉर्मल सलाइन या आरएल या स्टेराइल वाटर के साथ। अब हेल्थ एजुकेशन पेशेंट को हम लोग क्या देंगे? टू टेक विथ फुल ग्लास ऑफ वाटर। हमेशा जो है पेशेंट को फुल ग्लास ऑफ वाटर लेने बोलेंगे। नॉट टू टेक विथ फ्रूट जूसेस। अगर दवाई वो ले रहे हैं तो फ्रूट जूस का इस्तेमाल डोंट यूज फ्रूट जूसेस बिकॉज इट इज द एसिड लेवाइल ड्रग्स। टू नोटिफाई इफ डायरिया, डार्क यूरिन, एलर्जिक रिएक्शंस, पेल स्टूल्स, jaundice of eye or skin or severe abdominal pain, we have to inform the doctors. So these are the nursing responsibility and health education, and this is the side effect and this is the usage. So all macrolides are completed. So complete watch and subscribe my channel and press the bell icon. Thank you. God bless you.